Hi everyone, so this is the podcast on the presentation assignment for your Critical Social Work Interventions course. This is the second assignment. You will have already submitted your essay. This assignment is basically a 20-minute presentation to an academic, a service user and a group of peers, so a group of students. It's worth 40% of the overall credits for this course, so it's quite important. And just to talk you through a little bit about doing a presentation. So it's a 20-minute presentation, but we'll be asking you, either the academic or the service user care rep will be asking you a question at the end. So we're really looking for approximately 18 minutes. We will not be letting you run beyond 20 minutes, certainly, and you will be stopped if you run out of time. Okay, so it's important to think about how should you structure your presentation. It's important for there to be a clear introductory slide, and at the end it's important for you to have a references list. Throughout on each slide it's important for you to reference your the points that you're making. How does the literature fit? And that's because this is an academic essay for a master's level course. That attracts 40% of the credits. So really rather important to remember, this is not just about you presenting and showing good charisma and presentation skills. This is about an academic task as well as demonstrating good presentation skills. In terms of the students sometimes ask, how many slides should I include? Well, if you think about it, each slide should be about you making a point in relation to your topic. And if you think about how long does it take for you to make a point, it's probably about 2 to 3 minutes to make a decent point in depth, referencing the literature in relation to that point, and saying what you think about that point. And therefore, I would suggest that if it's going to take 2 to 3 minutes to do that, then, and there's 1 point per slide, then really you should have no more than 10 slides for this task. In terms of how much to put on a slide, well, some people have different sort of ways of presenting, but I would suggest that it's important not to overwhelm the audience by having too much text. So we would recommend maybe 4 or 5 or 6 bullet points per slide, and that those bullet points should be just that. They should be concise and they should sort of be points for you to talk around. So don't read from the slides, because that's going to detract from the point that you're trying to make. Okay, so let me take you through the criteria for this and the title of the presentation. So the title is that we wanted to present on the role and contribution of social work in a multidisciplinary or multi-agency team context, selecting one aspect of practice in one of the following areas: children and families, or mental health, or social work with adults. Okay, so again, really important, like the essay, this is not about you talking about the whole of mental health or the whole of children and families or the whole of adult services. This is about you talking about a specific topic where multidisciplinary issues arise, or where social work is involved in multidisciplinary collaboration. So, what are the assessment criteria? Make sure you read them in depth. I'm going to take you through them now, but make sure you reread them before you start planning your presentation. They're on page 9 and 10 of the syllabus. Okay, the first criteria is to provide a critical analysis of the role and contributions of social work in a multidisciplinary or multi-agency context. So, how do professions come together? How does social work add to the way that professions come together? What's the status of social work in the way that social professions come together? Do social workers have a primary role, as they might do, say, for example, in implementing the Children Act? Or do they have a secondary role in supporting, say, a multidisciplinary team in health, or are they embedded as a partner within a multidisciplinary team, as they might be in a CAM setting or in a community mental health team setting? So do be thinking about, how does social work, first of all, feature in the structure of the team, or how does it come together at meetings or forums with other disciplines? What's the status of social work in relation to that, and how's that thought about in the literature? Those sorts of things. And yes, and what's the value added by the social work? And where would this topic or this team coming together be if social work wasn't there? So those are the sorts of important things to be thinking about in relation to the first criterion. Okay, for the second criterion, that's a critical assessment of literature, theory and research evidence on multidisciplinary or multi-agency team working in relation to your chosen topic. Again, just to re-emphasise, this is an academic task. You must refer to literature. This is not about just doing a presentation where you use your presentation skills. This is an academic task. So be thinking about how does the literature on your chosen topic reference multidisciplinary work or partnership working? And are there gaps in the literature? Does the literature talk to itself? For example, does one writer agree with another writer, or do they fundamentally disagree? And that's important for you to sort of point out some of those tensions. It's also important for you to think about whether or not international literature is relevant to the UK context, and whether literature from a number of decades previously is still relevant given all the changes that we've had in social work policy over the last little while. Provide references as you would in an essay on the slides, and also provide a full reference list, as I said earlier on. Really important. The third criterion is to provide a critical analysis of the opportunities for promoting a social work perspective in working in this area. This is fairly similar to the first criterion. It's about thinking about the value added and being really critical about a social work perspective. So what is a social work perspective in working in this area? And how does it differ from the perspectives and the discourse that goes on from other professions? You may find that you're working with a dominant discourse. For example, when working in a hospital team, is the medical model dominant? When working in the court system, is a legalist discourse dominant? When working with, education, what's their take? What about the police? Do they have a sort of forensic criminal take that fundamentally clashes with social work's take? And what are the opportunities for social workers to explain their position and to explain their value base and to explain their perspective? And really drilling down, in relation to that would be important. The next criterion is an understanding of how inequality and discrimination can manifest themselves within your chosen topic area, and how those are addressed in multi-agency or multidisciplinary practice. Again, a bit like the essay, thinking about, isms like racism, sexism, ageism, homophobia. How do those issues arise in this multi-agency endeavour? And are there problems that need to be addressed? Are you aware of problems? Some of those problems might arise from the policy context. For example, when working with people with no recourse to public funds or asylum seekers, are there problems that arise, and how are those addressed, or how should those be addressed, in your opinion? Have a think about that, because inequality issues will arise from some of the discourses that other professions or even social workers use, in terms of, you think about social workers using eligibility criteria and things like that, and resource allocation. So have a good think about that. The next criteria is the ability to use PowerPoint in your presentation. You can discuss with your seminar lead tutor if you want to use a different tool, but we do recommend using PowerPoint because it is the dominant way that people present in social work at team meetings, at forums where social workers come together. And it's important for us to know that you're able to use that. And as I said at the start, there are particular rules for using PowerPoint in terms of not overcrowding your slides and so on. And the last of the criteria is the ability to deliver and communicate information in a clear and coherent manner. So remember that there will be a service user or carer rep on the panel, and it's important that you're able to explain complex academic material in a way that they're going to understand. Now that doesn't mean dumbing it down so that this isn't an academic piece of work. It just means that you should be able to present it in a clear way so that the person understands what you're saying. We want the slides to be coherent. We want your argument to be coherent so that you're you're telling a story from slide 1 to your last slide. And that narrative is clear, and that you're able to present it in a way that's fluent, and that you're not getting distracted. And while everybody gets nervous when they're presenting, that's fine, we completely appreciate that. But are you able to tell a story that's coherent about your chosen topic in relation to how professions come together and how multidisciplinary work happens in this area of social work? The last word for me is just to practice, practice, practice. Use friends, use peers, because you will be presenting in front of them. Use family members, friends, and mobile phones these days have all sorts of voice memo apps, so use those because you can time yourself on those. You don't want to run out of time in your presentation. Best of luck with it, and do talk to your seminar lead tutor if you have any questions. Good luck.